Welcome back. Does alcohol consumption diminish on GLP-1 agonist medications like the Ozempic, Mounjaro, ZepBound, Wegovy? This is a question that I've been getting recently, and a patient actually asked me this week on, can I start this medicine to help me with reducing the amount of alcohol that I kind of feel like drinking every day? So the research is still ongoing, but some of the clinical trials and the anecdotal results that we're getting, meaning case by case results that we're getting and reports that we're hearing from patients, is that since starting this medication, Ozempic, for their diabetes, or maybe using the Mounjaro for their diabetes, and also for patients that are using the weight loss versions of this drug like the Wegovy and ZepBound for weight loss, they're reporting that their appetite for alcohol has significantly, noticeably diminished. And it's to the point where some patients are considering whether they should stay on this medicine long term to try to help them with this problem. So as we know, the prevalence of alcoholism in this country is not where we would like it. This is a drug that is kind of socially accepted, and so patients can be having problems with alcohol consumption and still be functional, right? During the day, they go about their day, they do their work, or they get home at night and they are consuming a lot. Ability to buy alcohol through the drive-thru, from your grocery store, order it online, and so on, has made it so convenient so people can drink, and sometimes excessively, right? You really have to go research what is considered a drink, because patients would sometimes tell us that they're just having a glass, but the size of the glass is crazy, right? So we really have to go back and say, what type of alcohol is it? What is the percentage of its content? And then really figure out how much a patient is really drinking. But let's just assume this patient knows there's a problem, right? This patient realizes they're drinking too much, and they're asking me, can I use this new class of drugs which is meant to improve blood sugar, improve weight, to also help me with my alcohol dependence? And so far, we cannot conclusively say for sure, but so far in my patient population, I am seeing a significant decrease in the appetite for alcohol on this class of medication. Is this something that we're going to eventually be recommending in the future? The studies are yet to tell us that, but if you're actually someone that's struggling with your weight, and part of that weight problem is because you drink alcohol, especially late at night after you get home from work, the least active part of your day, you're consuming too much alcohol, then going to bed. Well, of course, this is where we start to see problems with fatty liver, increase in abdominal girth, increase in visceral fat, and weight gain, and high blood pressure, and heart disease, and so on, right? We're starting to see problems from the alcohol use, not just metabolically, but within your relationship, with your loved ones at home, because they're noticing also your behavior changes because of this consumption. Could this be potentially something where it can be like killing, two birds with one stone? The studies are yet to answer that, but it is something that we are paying close attention to, because if truly we can use this medicine to help you with your weight, to help you with your blood sugar, to help you with that, fatty liver, and at the same time help you curb your appetite for alcohol, which can then help you go in, diminish how much of that you drink, that is a great thing. And it is something that I'm exploring. I am definitely looking into the studies that are coming out and to let my patients know if this would be a good option. Now, if you're already enjoying that benefit, that's great, because if we're using it to help you reduce your, what we call the risk of cardiovascular events, that's all really, really good, because now we're not only preventing you from having heart attacks and strokes, from too much weight, and from diabetes, but now we're also reducing some of the risk factors that is causing you to have those problems. So I am in favor of using this medicine favorably for patients that are also looking to reduce their alcohol intake, if it does turn out to be good for that. I am not making this video to say that I am saying that it is good for that, but from what I'm seeing from some patients that we have seen in our practice that are using the semaglutide, the Ozempic, Mounjaro, ZepBound, and also Wegovy, they are noticing an improvement in their appetite for alcohol, right? So that is a good thing, and I want to hear from you guys. If any of you are using these medications and are noticing similar effects, please mention it in this comment section below. And if you've had a not so good effect from this medication, maybe the side effects was too bad, the nausea, the vomiting, the constipation, or some of the mental side effects that people are now reporting, please mention it in the comment section below, so we can know, and weigh our risks and benefits to see maybe just continue with AA therapy, going to those therapy sessions is, or talking to the therapist and finding other solutions is going to be our way forward. So I appreciate you guys watching. Don't forget to subscribe. Don't forget to join our VIP group. Remember, we have the school group where we go into more depth about all of these topics that we're talking about here. The link is in the description section below. I'll see you on the next one. Bye.